Hello, my name is Nicolette, and today I will be discussing the breastfeeding complication of low maternal milk supply and infant hypoglycemia. When a mother's breast milk supply is inadequate, the baby is not receiving the amount of nutrition it needs to flourish and thrive. Because of the lack of caloric intake from breast milk, that baby's blood glucose may decrease and they may become hypoglycemic. There are a multitude of factors that can contribute to both a baby becoming hypoglycemic as well as factors affecting the mother's milk supply. First, let's look at the maternal end of the dyad. A mother's milk may be delayed or of low supply due to the following reasons. Polycystic ovarian syndrome, which is associated with an abnormal release of pituitary hormones. Sheehan syndrome, which is caused by a large amount of blood loss that affects the pituitary gland and its ability to function. This condition may cause the milk supply to not come in at all. Maternal medications, smoking, thyroid problems, a history of diabetes, obesity, as well as decrease in the normal proliferation and growth of breast alveolar tissue during the pregnancy, and lastly, breast surgery such as reduction or augmentation. On the other hand, possibilities of the infant to become hypoglycemic are an abnormal metabolic adaptation, an increased glucose demand, which can be caused by infants that are preterm or small for gestational age, those who have experienced significant intrapartum hypoxic or ischemic stress, and those whose mothers are diabetic. Possible signs and symptoms that a baby is experiencing hypoglycemia include, but are not limited to, jitteriness, fatigue, cyanosis, apnea, seizures, a high pitch or weak cry, poor feeding, tremors, irritability, tachypnea, diaphoresis, pale, instability, as well as cardiac arrest. Now, if we look at the mother and infant duo together, we can discuss the possibility of what may potentially be happening. There are a number of ways in which a mother and infant can influence each other with regards to low breast milk supply, leading to infant hypoglycemia. If the baby is not feeding frequently due to separation or missed cues, breast milk supply can potentially diminish. Also, if the baby is ineffectively feeding, such as an improper latch or a low intake, this can also contribute to a low breast milk supply. The top 3 priorities for this breastfeeding challenge are, number 1, to treat and resolve the infant hypoglycemia, number 2, to increase the maternal milk supply, number 3, to supplement if maternal milk supply is still insufficient. Next, we will discuss the treatment and management of low milk supply and infant hypoglycemia, keeping in mind the top 3 priorities that I just mentioned. First is the treatment of the infant. If the hypoglycemia is severe enough, it will be treated with IV glucose. Second is the treatment of the mother's low milk supply. There are 4 methods that can be used to promote milk supply. The first method is skin-to-skin contact between the mother and the babe, which is the first step to promoting breast milk. The warmth from the mother's skin can help regulate and conserve the baby's blood glucose stores, therefore assisting with the stabilization of blood glucose levels within the infant. Skin-to-skin contact can also help stimulate prolactin levels. Prolactin is a hormone that helps initiate and maintain breast milk production in pregnant and nursing women. The second method is hand expression. Hand expression helps stimulate prolactin and oxytocin. Hand expression can be used after each feed, which allows for extra colostrum to be provided to the baby, as well as assisting in increasing the milk supply. The combination of hand expression and skin-to-skin contact can increase the milk production by double in the first 24 hours after birth. The third method is an early breastfeeding assessment by the nurse. It is important to assess a proper latch as well as the mother's milk supply. The last method is stimulation of milk through the use of a mechanical breast pump. If these interventions, however, are unsuccessful and the mother is still producing poor amounts of breast milk, supplementation of the infant is the next step. There are 4 ways that an infant can be supplemented. The first method is cup feeding. The mother can hand express milk into a small cup. The baby can either sip or drink out of the cup. Breastfeeding is the first form of supplementation because the baby does not learn a different method of feeding, even though it doesn't teach breastfeeding. The supplemental nursing system is the next intervention that a baby can be supplemented with. A catheter supplying formula or donor breast milk is placed at the nipple, and the supplement is provided at the breast. It is the best way to supplement an infant if the baby is latching well. This is a good method because it still stimulates the maternal milk supply by the suckling of the infant. Finger feeding is the third way that a baby can be supplemented. It is beneficial because it reinforces the tongue placement during breastfeeding because the baby is still suckling. The last way that an infant can be supplemented is through bottle feeding. Bottle feeding is the last choice because the flow and bottle nipple are different than those of the human breast. Therefore, bottle feeding teaches the infant a new way of feeding and may result with difficulties when going back to the breast. This concludes our discussion about breast milk supply and infant hypoglycemia. To ensure your learning, I have 3 quick questions that you can ask yourself. The first question is multiple choice. What is not a sign of hypoglycemia in an infant? Fatigue, seizures, or abundant amount of feeding? The second question is, what are the top 3 priorities for this breastfeeding challenge? And lastly, a true or false question. If an infant's hypoglycemia is severe, it is treated with IV glucose. Thank you for listening.